And it's an honor, it's such a privilege to be here today, and it's exciting to be here with Liz as well, who, as you know, it was referenced, she's now the president of the Treasury Board. So that, like, she holds the purse strings to the government finances, right? And even more importantly than the finance minister, he's responsible for setting the agenda going forward to make sure we come back to balance next year. But literally on every significant funding decision, we as ministers, we need a Minister of Health, and all of our colleagues need to get past Liz. And so you can imagine on this issue, for example, because it is an issue that's so important to so many in this room, but particularly including Liz Sandals, that this is an issue that I'm really proud to be here today to be able to make the announcement. And in fact, we created an opportunity where I'm going to talk briefly about a couple of other funding announcements related to the area, which will benefit the citizens of Guelph and Wellington. So thank you all for being here today, and thank you for organizing this indoors and not outside. But really a big thank you to Guelph General Hospital for hosting us here today for this exciting announcement. And as I mentioned, it's great. It's always great to be doing events or making announcements or working with Liz. We do work in such close proximity in the legislature, but on so many issues, she's demonstrated that she is an incredible advocate, not simply for the residents of this area and region, but in addition to that, or as part of that, but more generally speaking, particularly for the most vulnerable, for individuals that maybe are a little more challenged in getting access to the healthcare services, or perhaps because of their socioeconomic challenges that they need some support that most or many of us here in this room would not necessarily think as a priority, but are absolutely vital for those individuals to be able to accomplish and be the best they can be and to fully contribute as members of their communities. So she's not only a great public servant, but she is a true champion of people who reside here, and as I mentioned, for Ontario's most vulnerable. So that, for those reasons, it's so important to have her around the cabinet table when we have discussions, whatever ministry might be leading the discussion. Her insight and her perspective is extremely important, and often has a tremendous influence in decisions that are made at that level of cabinet or elsewhere in government. So I also want to take a moment to acknowledge all of the many Guelph and Wellington community partners in healthcare who are here with us today, the community leaders who came out in full force to help make this announcement today possible. I was struck by the list of individuals referenced, or the entities, the network that exists, particularly for mental health in this region, with the knowledge as well of how effectively they are working together. And that really is a model that we need to emulate in other parts of the province, where the challenge, as has been mentioned, the challenge of organizations perhaps doing incredibly good work, but doing it somewhat in isolation. The ability for us to bring all the strengths together and to be able to work together collaboratively for the same goals is such a vital part of what we do. So we have representation here, I think, from 5 different hospitals, obviously multiple community organizations. We have Tony Lemon, the acting CEO of the LHIN, and Jeff Nesbitt as well, who's the board chair of the Waterloo Wellington LHIN. And as you can appreciate, I hear a lot about the 14 LHINs across the province, and particularly because of the changes that we are in the process of making over the course of the next year or so. But I hear tremendously positive things about this LHIN here. And it's always gratifying to know, and they're not all equal, they're not all even in terms of how they're viewed by their communities and the impact that they have in the collaborative relationship. But the Waterloo Wellington Kathleen will be happy that I already referenced her. The Waterloo Wellington LHIN is up there among the best of what we offer this province through that mechanism. So all of you here and your colleagues, no doubt, are working together extremely hard to put the needs of your community first. And good news announcements like the one I'm making today really are only possible because of the special kinds of people in our community. and the special kinds of people that work in our healthcare sector, doing the hard day-to-day work. And it doesn't matter whether there are extremely talented physicians, our skilled and compassionate nurses and paramedics, administrative staff, or the hundreds upon hundreds of volunteers. All of them, regardless of what their specific background and function might be, they know that this line of work, that the efforts that they make is more than a job. It's a calling, it's a commitment, and it's a passion. That calling is what enables us, and that commitment is what enables us to really make a difference in the lives of people across this province. And I know as well it's a tough and often thankless job. I know especially so it can be for those of you working with mental health addictions. I know it's incredibly rewarding, but it's also remarkably challenging. And when it comes to reaching out for help from our healthcare system, most Ontarians obviously don't even think twice when they might have a broken bone or perhaps need sutures or stitches. But the unfortunate reality is that most people remain hesitant to talk about their problems if they are experiencing mental health challenges. And as far as we've collectively come as a society in dealing with issues related to healthcare, there are still tremendous strides that need to take place with respect to mental health. And while more and more as a society we're beginning to open up on issues related to mental health, we know that we still aren't where we need to be. We need to do much, much more to continue to dispel and eliminate the stigma around mental health. We need to do more to support and encourage people with mental health challenges to speak up and to share with others the challenges that they are facing. I'd hazard a guess that not one of us in this room doesn't have a loved one or a friend or a colleague or a neighbor that hasn't or isn't experiencing a mental health challenge. It's that pervasive in our society. So we need to do more to create an environment where people feel it's safe to share their struggles. And our government is committed, as all of you are, to shining a light on this issue. I also think it's important today, because of where we are, to remember the tragedy that happened just over a year ago. And no one can undo what happened. But what followed that tragic event was pretty remarkable. The community here rallied together as a united front and came up with a plan to make changes so that tragedies like the death of Brandon Duncan wouldn't happen again. Ladies and gentlemen, people struggling with mental health challenges deserve access to services in the same way that someone with a broken leg would receive care. And the brave and compassionate people in our hospitals and our community health organizations also deserve to feel safe and supported by their government. Now, as Ontario's Minister of Health and Long-Term Care, I've made it a priority to improve access to mental health and addiction services for all people in Ontario. So that's why I'm pleased to be here today to announce that our government is providing over $3 million to expand emergency mental health services at the Guelph General Hospital, Groves Memorial Hospital, and Wellington Hospitals. And so this investment will help ensure that Guelph General Hospital, well, not help ensure, it will ensure that Guelph General Hospital has a mental health nurse available 24 hours a day. Because when someone is in crisis, and we know that nighttime is often the hardest time for people experiencing mental health challenges, they need to be able to access help when they need it. And at Groves Memorial Hospital, Palmerston District Hospital, and Louise Marshall Hospital, mental health assessments will now be available in evenings, weekends, and on holidays. So this investment represents a huge improvement in access to emergency mental health supports for the community here in Guelph and in Wellington County. And it means that those Ontarians and their families who need crisis support will have access to more care, while also helping to reduce the wait times for appointments for community psychiatric services. And all of this is possible thanks and only to the hard work and advocacy of your community. So that's mental health. But in addition to this funding for emergency mental health services, our government is making further investments in the region. We're increasing operating funding this year for Guelph General Hospital by over $2.5 million. And we're increasing operating funding to St. Joseph's Healthcare by over $650,000 this year, an increase in the budget of more than 3.5%. And one which I particularly like, not that I dislike the other ones that I've read, that was close. We are investing more than $100,000 in the continuation of the local community paramedicine pilot program. I don't know if we have any paramedics with us today. And so we are funding, I think it's about 30 different programs right around the province where our, and it's an incredibly innovative program as well, where our paramedics will essentially drop by or drop in to check on the frail elderly or individuals with chronic diseases that have exacerbations where their condition may go up or down depending on a whole variety